We talked about Medicare supplements. Now let's talk about Medicare Advantage plans, okay? Your other option. Now, a Medicare Advantage plan is a private plan that's going to replace your Medicare and become your primary. Some or most are going to have a zero premium, okay? Now, how does that work? How can they offer a zero premium? Medicare stops paying any claims on your behalf if you enroll in that Advantage plan, and they pay a certain amount per month, per enrollee, to that Advantage plan to manage your health. It's going to vary the amount they get on where you live, a lot of factors. The plans can get bonuses. There's a huge algorithm that helps determine this, but that's how you can get a plan that has zero premium in addition to the Part B premium. Okay, again, these plans are going to replace your Medicare and become your primary. The plan is going to have copays, co-insurance amounts for all of your services that will all go to a maximum out of pocket for the year. In 2025, that maximum is $7,550 in network. Now, a lot of Medicare Advantage plans are going to offer a maximum out of pocket that's significantly lower than that, but that's the highest that Medicare does allow, and that does change on an annual basis. Okay, now an Advantage plan will typically include your Part D prescription coverage. You can get an HMO or a PPO type plan. With an HMO, you're going to be required to use only in-network providers. You're only going to have emergency coverage out of network. A PPO will allow you to use in and out of network doctors. Now, a myth that I really want to bring up is people think when they enroll in a PPO that they have coverage everywhere. That is not the case, okay? With a PPO, you will not be able to see every provider. You will have out-of-network coverage, but not coverage everywhere, okay? There will be providers who won't see you on a Medicare Advantage plan. Now, there are also different types of Medicare Advantage plans. There are plans that offer a Part B give back. What that is the plan will pay you back a portion of your Medicare Part B premium. Some people have budget concerns and they need to get some of that Part B premium back, so there are plans that are offered. Now, the plans are going to offer dental, vision, hearing, lots of other benefits, again, that I talked about before that are not covered by our original Medicare. I do want to bring up two things here. Those richer benefits that are paying above and beyond what traditional Medicare covers are going to affect how your health care is received. These plans are giving you additional benefits, okay? It may have more restrictions on your access to providers. They may require you to do more prior authorization before a surgery. Just look at all of these. I want to make sure everyone purchases a plan or enrolls in a plan based on what they are worried about for the future. Don't buy a plan because of you're healthy today. You don't know what's going to happen tomorrow, so make sure that you're getting a plan that's going to cover your core health benefits. Please, please, please don't purchase a plan based on the dental. I've seen it burn too many. Too many people have gotten burned because they got the additional dental coverage. If the plan covers everything you need with your health and it has great dental, that's amazing, but just make sure your health is covered first. Okay, now, we're gonna use this knee surgery example like we did with the supplement or original Medicare. With Medicare Advantage, you need to get an authorization for the surgery. You need to make sure all the providers were in network. You would pay a copay, most likely, for every day that you were in the hospital, co-insurance for the surgery, a percentage of it. You would pay copays for all the follow-up doctor visits or the PT, as well as copays for your prescriptions. All of those costs would go toward your plan's maximum out-of-pocket for the year, which again, 2025, the maximum out-of-pocket you can have is $7,550.